Welcome to the Health Workforce Technical Assistance Center's webinar series. This webinar is entitled Program Evaluation. What is it and how can you use it to improve program performance? Part 1. And it was presented by Robert Martiniano and Amanda Norton on September 14th, 2017.
Hello, my name is David Armstrong. I'm the Director of the Health Workforce Technical Assistance Center. And today's event is the first of a two-part series on program evaluation. But before we get started, I'd like to go ahead and introduce today's speakers. Amanda Norton is a quality improvement consultant who has been working in the field since 2009, and Robert Martiniano is a senior program manager at the New York Center for Health Workforce Studies. And with that said, I'm just going to go ahead and turn the event over to Robert at this point in time.
Thank you. So as David said, Amanda and I are going to be tag teaming this presentation. We actually are following an evaluation guide that we have developed for HRSA that at some point you will be seeing. Right now it's in the review stage. But what we've really tried to do is walk through not only the background of what an evaluation is, but how to do it and how to use it from your perspective as program managers to try to understand your programs. So as David said, this is actually a two-part webinar series. The first part is today, again, an overview, and the second part is going to be 2 weeks from today, September 28th, and then we're going to take the things that we've talked about today and actually apply them to some HRSA programs. So again, today focuses on some basic concepts in evaluation. So the second half on September 28th, we're really going to take what we've done today and apply that to some of your different programs and try to understand how to use that to better understand the pluses and minuses and where you need to go with your programs. So at this point, I'm going to turn it over to Amanda.
Great. Thanks so much, Robert and David, for the introduction. We can probably hop right on to the next slide. So I'm going to talk to you a little bit about program evaluation. What is program evaluation? You know, I think that program evaluation is something that we hear often, but don't often think through in detail the impact that it can have on programs and how we can use those evaluations to make some decision about the collective impact of the work that we're doing. And so program evaluation, as defined by the CDC, is a systematic method for collecting, analyzing, and using data to examine the effectiveness and efficiency of programs and to contribute to continuous program improvement. And so, as you'll see as we continue to talk about this, there's really a distinction in this definition between effectiveness and efficiency. But at the end of the day, we're using this to determine if programs and projects are performing activities as we said or thought they would. You know, we all know that we put forth these programs and we have a clear plan in mind. We also know that reality tends to be a bit different, and so when we begin to implement programs or projects, it doesn't always go according as planned. And so program evaluation can help us say, is this happening as our work plan set forth that it would? It also lets us know not only is it happening as we thought it would, are we achieving and or exceeding those goals and objectives? So at the bare bones, are we meeting the minimum standard, or are we going above and beyond those objectives? It also helps us internally to make sure we're spending funds in an appropriate manner. And so what happens sometimes if we're not using program evaluation is we get to kind of the middle of a project and realize, geez, we haven't spent as much money as we should have or needed to, or we're not meeting our objectives and perhaps spending a little more money now is an appropriate idea or change. And then the last two is making sure that it's operating efficiently and effectively. So let's talk about that. Next slide. So efficiency versus effectiveness. In definitions, efficiency is doing things right. Effectiveness is doing the right things. And so I like to think about efficiency, you know, you can do things right so you end up with the right kind of process, but are you doing the right things? Efficiency can include conducting a project that is cost effective without errors. So you're getting through, you're kind of ticking all the boxes, you're doing what you need to do. But effectiveness is saying, are you achieving those goals? Has it been successful? So I often refer to this as the so what question. And if you could see me in my office right now, you would see me with air quotes. When I say so what, it's not meant to be condescending. It's meant to say, so how are people, patients, we are dealing in a healthcare setting always, or with individuals who are in healthcare settings. So how are individuals or programs or students or training healthcare professionals, how are they better off because of the work that we're doing? Which you need both. We can have patients that are better off, but a really inefficient process to get there. And in using this incredibly inefficient process, what it tends to mean is that, yeah, we're effective, but we're effective at a much smaller scale than we could have been if we have been both efficient and effective. And so the efficiency, in my mind, and I kind of pose this if you feel differently, I think this is a good point for conversation if we need some conversation. If you're not efficient, then your effectiveness is the scale is small. If you are both efficient and effective, you can have a larger volume or a larger impact across the population. All right, so let's move on to the next slide. So why is program evaluation important? And this is, I have spent a lot of my career working with small, either community-based organizations or health centers, and they'll sometimes say to me, well, sure, maybe it's important, but I don't have the money or time or resources to do that. And I like to push back on that concept because program evaluation is really important across the board. So program evaluation can assist project managers in understanding the links between goals, activities, resource consumption, and outcomes, and understanding that there's a system at play here. It's one thing to set up goals and objectives, but you're going to have to participate in a certain amount of resource activities and resource consumptions in order to get those outcomes that you're seeking. And so sometimes we will set up the objectives, but we won't change what we're doing, and we're kind of surprised at the end when the outcomes don't happen. And so program evaluation helps us to keep those linked together to see that system as a whole, but also make sure that we have an opportunity to do something about it as we move forward. So program evaluation can assist funding entities as well in both identifying successes or issues and potential corrective action. And so it's often a checkpoint rather than, it depends on the type of evaluation, which we'll talk about later, but it's often a check-in to say, okay, well, these were our objectives. Where are we in getting closer to those outcomes? And if we're not getting there, how do we reallocate and shift our work to get us closer? So it allows you to think about adjusting the activities, adjusting the funding and resources. Maybe you had set aside a whole lot of funding for a specific training and you're finding that that's not the biggest issue you're having right now, that you need to put that towards some different resourcing. It can also help you streamline or refine and redesign the project if you're finding that that efficiency is not truly there. And so the program evaluation will allow you to streamline so that you can find the efficiency rather than kind of survive the inefficiency. And I think we've all been part of those kind of programs where it feels like we're just surviving the inefficiency rather than tweaking it and making it more efficient as we move through. Sometimes we just have to set more realistic objectives. I think as project officers, you all are accustomed to reviewing grants that have been put together or applications that have been put together sometimes on a really short timeline or with really ambitious, well-meaning, driven individuals in the room. But at times, there's a true distinction between what you thought you could accomplish as you were applying to what you really find out you can accomplish now that you've got the money and you're making this a reality. And so I think this, to me, is one of those really important things for you to think about as project officers, because there is sometimes a real distinction between what your applicants really truly believe they could to what reality sets in when they find out that it really is their opportunity to do this, because you put together the best possible application, but it's different when you find out, okay, now I really need to do it. It also can help you discontinue the ineffective things, which we talked about, or discontinue the project in general. I think project discontinuation is easier than program discontinuation, so you can find there's a certain aspect of your larger program that's not working, and so the program evaluation can help you not waste resources on that and move forward and make some successful changes or discontinuation so you can use those kind of inefficiently used resources towards something better. Next slide.
Hi, this is Robert. Amanda, you said something that I kind of wanted to add on to when you talked about adjusting the activities. I think it's important that people understand how to time an evaluation. And if you're thinking about implementing a program, you should be simultaneously thinking about what you need to do for an evaluation. You don't want to do your evaluation halfway through your program or project because you may not have set it up correctly to identify the sources you want to identify to actually assess what you need to assess. So again, I think it's important that it starts at the beginning of your program or project and works hand in hand all the way through it.
Robert, that's a really good point, and thanks. I didn't specify that. And you bring up a good point. Sometimes program evaluation isn't initiated until you realize there's a problem with your program, and it's often too late. And so really thinking about initiating program evaluation when you initiate a program so that you have a better sense of what is truly changing or moving throughout that work. So what are some of the methods of program evaluation? And so we have this experimental method, and I think we often think about this when we think about program evaluation. So thinking about the impact of a specific program or intervention or experience on a group versus a group of individuals who don't get that intervention or experience or intervention. So I often work with organizations who think that's kind of the only possible option for program evaluation, and I think it's one that we use often to say, you know, we have this group of people who are going to get it and this group of people who aren't going to get it. Sometimes in healthcare we steer clear of that a little bit because there's always a case to be made of if we think this is really going to help a group of people, it's hard to withhold something that might really help a group of people, right? It doesn't feel like the right thing to do in healthcare. And we do some matching of groups by ages and gender and diagnosis, and the matching is meant to control for who the people are so that you can say the people who got it in general are very similar, although not exactly the same, to the people who didn't get it. And that similarity allows you to have more confidence if there's a difference in the group that your intervention is what caused that, rather than just differences and nuances in who they are by gender or socioeconomic status. And then there's this non-experimental where everybody gets the intervention, but you rely on some pre-test versus post-test to gather a sense of impact. You might look at time series data or aggregate data. You could longitudinally follow individuals. So, and we see a lot of healthcare research done this way where we're going to follow somebody for, say, a year or 5 years or 10 years. And then at times, and I would contest, and Robert, feel free to push back on this, at times post-test only tends to come up when program evaluation wasn't initiated in the very beginning. So if we didn't initiate a plan for program evaluation in the beginning and that plan didn't come to fruition until the middle or close to the end of the project, we tend to do a little more post-test only kind of method. Would you agree, Robert?
Totally, and I think that it becomes a problem then because you don't know if there's been a change. You know, the good thing about either pre-test, post-test, or longitudinal, even time series, you're tracking people over some set time, so if there's an intervention in between, you can see what's the differences in what happened. If you just do a post-test, you're not really sure where you started. And again, and going back to our point we already talked about, is if you're thinking about evaluation at the beginning, you're also thinking about the baseline you need to create, and we'll talk about data a little later. But you also need to think about the baseline you need to create to really assess your project or program.
So let's move on and think about the types of evaluation. So we're going to go through each of these individual, but there are some distinctions. There's a formative evaluation, which is really a process evaluation. And then there are summative evaluations, those evaluations that look at outcomes, impact, cost effectiveness, or cost benefit. And evaluations can and often are kind of a mixed bag of these things. So they could have some elements of a process evaluation along with elements of an outcome or cost effectiveness evaluation. So it's important to me that you realize that I don't see them as standing alone. They can stand alone, and sometimes they do. But often when you're putting together an evaluation plan, you mix and match a little bit. And then there's also a needs assessment or a gap analysis. And this is sometimes done before programs begin, but let's go on to the next slide and look at this in more detail. So process evaluation assesses the extent to which project activities are completed as intended. And so this gets to me again back at the efficiency. So we have said that this is what we're going to do. Are we physically doing it? And the process is important in evaluating anything. If you're not physically doing it, the outcomes somewhat don't matter. So if you set up a really great program and you can't serve anybody, then the process isn't happening as intended, and the outcome can't actually be seen or not seen. There's also a needs assessment or a gap analysis, and so this assesses the difference between what currently is and what could be or what needs to be. I often see these as happening before we implement a program or a project, so you do your needs assessment or your gap analysis to do some proof of concept. So in the designing or the development of your program, you can say, all right, well, this is what I learned from my needs assessment, and this gives me increased confidence that my program or project that I'm going to implement is going to address that need, because we're not looking for just additional programs and projects, right? We've got a lot of stuff going on in healthcare. We don't need just additional things that don't fit a specific gap. And in all honesty, we can't afford to add things that don't fit a specific gap. Let's move on to the next slide. So from there, we go into our summative evaluations. And so our summative evaluations, the first one we're looking at is outcomes. Assessing the extent to which the program or project outcomes are achieved. So every project that's ever going to be funded is going to have to say what it thinks it's going to accomplish. And so those outcomes are important. For you all as project officers, you want to see that the funding that you release, the programs that come back to you, have done what they said they were going to do. And so the outcomes evaluation helps you to feel more confidence in that, to say, yeah, this is what they proposed and what they were actually able to achieve. An impact evaluation assesses the effect of the program compared to having had no program. And so this is one of those, I would see it as kind of if we were to use the method of having a control group versus an intervention group. So if we were to think about an impact evaluation, we would have these two groups to say, well, this is what happened when we had the program, and this is what happens when we don't have that program. It also assesses for unintended consequences of the program, both good and bad, and so it looks at kind of the flip side of the coin. What is the balancing side of this work? Cost-effective evaluation is something that we're hearing much more about in healthcare, return on investment, or can we look at both cost-effective and cost-benefit? But cost-effective is looking at assessing the cost of meeting the program outcomes with the overall per participant compared to the other potential activities. And so if we were to say, all right, it costs this much per person who goes through our program, let's compare that to either not having the program and the potential outcomes or having a kind of lighter version of the program, a less costly version of the program. Where, in contrast, the cost-benefit evaluation is looking at assessing the cost of the project for the community compared to what's going to happen to the community as a whole if we don't have that. And so I think cost-effective, the way that I categorize this for myself, just to clarify the difference between these, is that cost-effective is looking at kind of person by person, where cost-benefit is looking more at the value of a community and the impact that this particular program can have on the population at large. And Robert, would you add anything to that?
No, I think that covers it all. I think that's very good.
In my mind, for a long time, I got cost-effective and cost-benefit just kind of confused. And so thinking about it per person versus population health is really helpful for me.
Hi, excuse me.
Oh, yeah, hi.
Sorry, I did have one question. And excuse the ignorance, what did you mean by unintended consequences? Can you go into elaborate a little bit on that?
Yeah, so I think with every program, there is the possibility that there is something that happens that you don't expect. And so I spend most of my work, I'm going to take this down to a really nitty-gritty in the detail level, and it'll be probably too low, but this is just the way I'm thinking about it. You know, if we're going to implement a new program for pediatric offices, and we're going to work to get pediatricians to do more developmental screening, or we're going to make sure we can identify more kids with ADHD. If we're implementing this program to see if we can improve those outcomes, we can find more kids with developmental disabilities or ADHD specifically, is there a flip side to that coin? Is there an outcome that's unintended that comes from that? And sometimes unintended outcomes are as simple as now our workflow in the office is much behind because we're spending so much more time with these families, or sometimes the unintended outcome is, all right, we did a whole lot of screening, we've got to send a lot more patients on for further genetic evaluation, and what we're finding in our community is a backlog. We can't get any patients in. And so to me, it's just, it allows us to open up and think more effectively about the system and realize all the pressures we put, all the programs we implement, there's an outcome we really hope for, but there are kind of offshoots of potential outcomes that could happen. And this idea of kind of backlogging the system sometimes happens is the one that I see most often. Does that clarify your question?
Yes, thank you so much.
I mean, sometimes we think about it in the consideration of worst case scenarios, but I don't think it's that. It's just, you know, if we front load one thing, does it influence something else? So things to consider. What is the purpose of the evaluation and the evaluation questions being posed? And this is, in my work doing evaluations, this is where I spend my most time with any organization, asking them, what do they hope to get out of this evaluation? Because it guides you into deciding the type of evaluation you need to set forth. But we don't always spend a lot of time here. We just think, oh, we have to do an evaluation. And so this is a really important first step. Thinking about who is going to be conducting this evaluation. Is it something that we're going to do internally? Is it important to us and we think we have the capacity, skills, knowledge, ability to do it? Or is it something that we're going to do externally, where we're going to find somebody who this is what they do and they do it well, and we're going to allow them to come into our system and do some evaluation? I see pros and cons of both. Nobody understands your system, your program like you do. Sometimes you understand your program so well you can't think externally enough to really truly evaluate it. What's the evaluation design and scope? Because partially this comes down to dollar amounts, but partially this comes down to understanding the purpose. And so you don't want to outscope your evaluation if the purpose is a little bit smaller. And thinking about methods of data collection. And so I have seen and reviewed several really strong evaluation plans that consisted of data that could not feasibly or possibly be collected. And so it's a fantastic plan, but placed in reality, it requests data that's not practical or possible. And so thinking about, is this data and the methods of data collection, is it possible and practical as you're putting forth your evaluation is a really key consideration.
Thank you. So before we go further, Amanda's kind of giving you some background and concepts. Does anybody have any questions? We're going to start getting into a little more of the nitty-gritty. Okay. So one of the things we did with both this presentation and with the evaluation guide is we actually looked at the CDC evaluation framework. And today we're really going to talk about from engaging stakeholders to kind of starting to focus the evaluation design. That's the focus of today's presentation, and the final three, as well as the discussion of that inner circle, will be at the next webinar. So let's start by talking about the stakeholders. You know, unfortunately, when we do any kind of project or program, everybody has an interest. It could be financial, it could be programmatic, it could be the people you're serving, it could be policy. And all those, as we develop a program and as we develop the evaluation, must be taken into consideration. What are their, you know, essentially what are their interests and what are their expectations? And I think a difficult part for an evaluator is to try to manage all those expectations, especially when you have multiple stakeholders. It is, you know, so you have to think about who are your stakeholders, what are their interests, and how can I manage their interests as I'm trying to either implement a project and or create and implement an evaluation. The next thing you want to do is describe the program. You really need to understand, you know, as an evaluator, you need to understand the program in order to create an appropriate evaluation. What are the overall objectives? What are the activities? And we're going to go into these terms. What are the resources needed? And what are the projected and anticipated outcomes? You need to understand where your project is going and how you can use those guidelines and that development to really understand where the evaluation needs to go. And finally, I wanted to talk a little about understanding context. And the reason why I wanted to do that, while it may be somewhat out of place here, as you think about your evaluation, especially, you need to put it into context. As you think about your ultimate findings, again, you need to put it into context. You need to understand what the organization that's implementing the program, where they're at, what's their mission, vision, and values, what is their focus. Because if you create an evaluation and you give a finding or recommendation that doesn't make sense for them, you've just wasted the time, their time and possibly yours. Similarly, what's going on in the environment? Is there a change in health policy? Is there a change in reimbursement policy? Is there some change that you need to account for as you're doing your evaluation to make sure you're capturing, that your findings kind of take into context and understand that as you're presenting your information. So again, it's really important that, again, you describe your program as well as understand the context in which you're developing your evaluation and your program is being implemented. Before I go on, are there any specific questions? So the first step is creating an evaluation purpose statement. And really what that is a one sentence, maybe two, that really describes at a basic level what your evaluation is trying to do. What is being assessed, why it's being assessed, and even sometimes how it's being assessed. And I've included several examples, and again, you'll see that it's a process evaluation, an outcomes evaluation, and a cost-effective evaluation. And in each of these cases, we've talked about a program that actually HRSA runs, and we've kind of given some overview of what we want the evaluation to look like. And again, as I said, in the third case, we actually start talking about how in terms of being cost-effective. So again, these purpose statements, you should, one, create at the beginning of the evaluation, also probably at the beginning of your project or program, and also be broad enough to give some understanding where you need to go, but not so narrow that you don't have any flexibility in developing your evaluation. And we're actually going to use these examples in a little bit too. So the next thing, once you've developed your evaluation purpose statement, the next thing you want to do is your evaluation questions. And in this case, you're starting to consider a causal relationship. What are you looking at? What leads to what? It does differ by the type of evaluation. Obviously, if it's a process evaluation, you care more about the activities and obviously the process, and you're asking who, what, when, where, why, and how. What happened? Why did it happen? You don't necessarily care about the outcomes, but you care about the process. In summative evaluations, you're starting to look at other things, again, outcomes or impact and cost, whether something's cost effective. And again, we're going to go into these terms shortly. And finally, in needs assessment, you're thinking about what are the current needs, if there are current projects, are they meeting those needs? If there aren't any projects or programs for those needs, what do you need to do to try to meet those needs? So we're really starting to ask questions about giving a little more depth to the evaluation and starting to focus it in. Any questions before I go on? And I've got a couple of examples. So in this first one, we're going back to the process evaluation, and we're doing the Telehealth Resource Center again, which was the first example we used. And we're asking, what did we do? And so in this case, our purpose is what did we do, and did we do it within the time frames? And then we start with our research question, being more specific about what were the activities, what staff were assigned to carrying out the activities, And did those activities come within the projected or anticipated work plan and timeline? So as you've seen, we've taken the process evaluation, the purpose statement, and now expanded upon it. Now, sometimes you can say, well, maybe it's got too much depth, maybe it doesn't, but it really does give some direction to the evaluator and to the people looking at, from the outside, looking at the evaluation saying, I understand what they're trying to do. Let's go on to the outcome evaluation. And again, in this case, we're using the Federal Home Visiting Program as I did before, and the purpose of it is to understand your project objectives. So in this case, we're asking questions about what are the results or consequences of the program. Did we meet those? Who benefited from meeting those? In some ways, it doesn't necessarily tell you what the specific outcomes we're looking at, but we're starting to think about those at a very broad level. Again, we're focusing it down from the purpose statement. You know, as you think about your purpose statement, your research question, the next step would actually be starting to develop a work plan and starting to develop evaluation objectives in terms of carrying out your project. And in this case, one objective could be increasing the number of families in the home visiting program. So you could say that's actually an outcome you're looking to achieve, or in that way you'd be evaluating that. So the last example I want to give for the evaluation question is around our cost-effective evaluation. And we're looking at the Area Health Education Center pipeline. Are we cost-effective in how we're doing this program? You know, as we looked at the number of high school or middle school students that we recruited and did something with, whether it was a match program or whatnot, what did it cost? How many students did we touch? Was it effective from a cost point of view? You know, as you think about a cost-effective, and I don't want to go too much into the weeds on that, but you have to think about both indirect and direct costs. Not necessarily for this example, but if you're doing a training program, there may be a cost of using the computer systems or the computer support staff that you may not have thought of as a direct cost, but may actually be a cost that you need to be aware of as you're implementing your program. Okay, so before I go to the next part of this webinar, does anybody have any questions about either purpose statements or research questions? And as an aside, it's kind of the same thing you would do not only in a research project, but we're kind of applying it to an evaluation. So there is a lot of crossover in terms of terminology. All right, so let's talk about objectives a little. And while this isn't necessarily part of an evaluation, I think it needs to be understood in the broader context. So an objective can be short and long term. And again, while it's not necessarily a focus of the evaluation in terms of creating objectives, you need to understand the objectives that were created for the project and how they fit into your evaluation. You know, ultimately, bad objectives equal to bad evaluations. So you really need to understand the objectives and how they fit in. Did they have time frames? Were their time frames reasonable and achievable? So, you know, you could say, well, in 2 years I want to, you know, increase something by 20%, which may make sense, but you may want to have more short-term objectives that you can lead up to that long-term objective. In the example I just gave, you know, I talked about time frames. And I also gave a percentage. So is it measurable? Is it something you can measure, that you can touch, that you can say, I can find data to understand how it turned out? And then the other thing with an objective is you really need to think about the activities, resources, people responsible, and the products that are coming out of those activities. You know, you want your objective to not only drive your program or your project, but also give a framework for the evaluator to understand what he or she needs to do. And in the next couple of slides, I want to go over kind of a good and bad objectives. Does anybody have any questions before I continue? Okay. So again, I left the phone open for a reason because I wanted more dialogue. So this is an example of a bad objective. Can anybody kind of tell me, again, just shout out why they think this is a bad objective?
Hi. It doesn't really talk about what exactly the committee is going to do.
Correct, that's one. There's no definition of the committee, okay. That's one thing. There are a couple more things that I think kind of jump out. Any other thoughts?
It's not really measurable either.
Right. Well, so why don't you think it's measurable? And there are actually a couple reasons why I personally don't think it's measurable, but go ahead. Why don't you think it's measurable?
It doesn't really have like a specific, it's not specific enough.
Right, exactly. So what do you mean by staffing satisfaction? That's a very ambiguous term. You know, you can't measure, you could measure satisfaction, but there's no direction how to measure satisfaction. You might want to think about another indicator. It also didn't indicate time frames. So, you know, we really don't have any, you know, if the evaluator looked at this, he or she really wouldn't know what to do. It's like, okay, you're telling me you've created a committee, I've got this amorphous thing of staff satisfaction that I have to look at, but I'm really not sure what you mean. You know, and there's no time frames, and do we want to increase it by 10%, 5%, 20%? There's no goals in here. Okay. So let's kind of go on to a kind of a better example. So in this case, staffing turnover, so now we've defined satisfaction by at least saying, let's use turnover as a proxy. We'll decrease by 20%, so we've actually now, good point. So someone made the note that there's no deadline either in the first one. Let's go back to that for a second. There we go. You're right. So we had no. Are you talking within 1 year, within 18 months, within 2 years? We don't know. So it's, again, as you go back to kind of what's good in objectives, you know, that first one really, it didn't have time frames. It wasn't measurable. We really didn't know what staff satisfaction meant. And it really didn't identify any of the activities, resources, or responsibilities to really kind of help the evaluator set an evaluation in motion. So in this case, now we've defined turnover. We've talked about 18 months, so we've given a time period. We've given a little more direction about the committee, and we've made it measurable. We said 10%. As you think about this one, is there, again, phones are open, so I'd like some feedback. What do you think, what else do you think you could add to this would give you a little more depth to this and a little more direction for your evaluator? Oh, so there was a point, where are we starting from? That's a good point. So it doesn't really create a baseline and some other things. So it does give a time frame, although we could use a little more depth in the time frame. It does give somebody who's responsible, although we might, again, we could use a little more depth in understanding who's responsible. So let's talk about the last one. So in this case, I've created an objective. Again, I've talked about the 10%. I've given a little more depth on who's involved in the committee. And I've also given some points along the kind of the axis where we're going to do things. So I've all of a sudden given the evaluator much more information on what we needed to, or what he or she needed to do to assess this objective. And so any questions about objectives? Again, I don't necessarily want to belabor the point that, you need to have a good objective in evaluation, but you need to understand how a good objective is developed so you can create your evaluation. One of the things that we want to do is use the logic model to understand how to do an evaluation. And as I've kind of talked about, and one of the things you're going to notice is the terms we've used throughout this, you're going to see again, activities and outputs and outcomes and objectives. It really does kind of become circular as you start doing this. There are multiple types of evaluation models, and this is just one. And I tell you that this is kind of what it looks like. But I've seen it where sometimes people have project objectives, sometimes they don't. The resources, activities, and outputs are always there. Outcomes can sometimes be short, intermediate, or long. Sometimes they can just be short and long. Sometimes they don't have impact. Sometimes the impact becomes a long-term outcome. And then indicators and sources I've really never seen, but to me, as someone who collects data all the time, I want to be able to move from, if I was to start with my project objective and walk all along, let's say, the top row, I should be able to identify my data source and my indicator that can measure that objective. And if I do that, that's a really great way of me saying, all right, my objective is to train people. Is there going to be a data source and a data indicator I can use to identify how to train those people? Another thing is the Kellogg Foundation has some really good resources on logic models, so you might want to check that out. And in the evaluation guide, when you finally do see it, we do have a link to that. So let's go back and talk about some of the terms. And again, we've talked about these. What's the program or project objective? What is the overall goal of the project, or maybe even a portion of the project if you want to do one thing at a time? And again, you need just enough to give direction to the evaluator. The next thing is resources and inputs. What do you need to accomplish your objectives? What staff time is going to be involved? Is there going to be external people you need to bring in to help you? Are there other resources within the organization that you need? Equipment? If you're going to do training, do you need rooms? Do you need computer infrastructure? What are you going to use to do the activities and the outcomes that you're looking at? Again, and don't forget that there are your other organizational infrastructure needs, again, such as room, computer equipment, things like that. Oh, we have a question. So I have a question, thoughts on objectivity of inside staff serving as evaluators. I guess I'm biased given that I do it. I think it can be problematic, and I think it also goes back to, and we'll talk about this in a couple weeks, but as you do an evaluation, you want to consider how your findings are going to be accepted. And if someone's going to look at the finding and say, yeah, this person was biased, it was an internal evaluation, the findings may not be accepted. So you really need to think about what you want to do, how you want your findings and your report accepted. Now, that being said, if you have a minimum amount of money, you may not have the ability to go outside. You know, as Amanda talked about, there are things you've got to balance and think about as you think about your evaluation and your evaluator. And time is one, money is one, understanding of the project or programs is a huge one too. Because if you bring in an outside evaluator, they're not going to necessarily understand your program or project on day one. They'll have to get up to speed. So you've got to kind of balance all that out. It's not an easy thing to do, and sometimes, ultimately, it's driven by money. But I guess from my perspective, and most of the things I think we do in government, I think it's probably better to have an outside evaluator. But again, there are a number of things that impact on that.
Yeah, this is Amanda. I would just say quickly that I think My experience is that we're often concerned, can we truly be objective and inside? And I think given a good, stable work environment where the leadership is open to whatever the results may be, yeah, we can be objective and internal. That there is sometimes some real tension between, if this evaluation doesn't say what you want it to, can I say that? And that to me has been the biggest concern to think about for internal evaluations.
Yeah, and as you think about, I talked about at the beginning, contextual, understanding the context of the organization, understanding the environmental context. This is part of that too. So any questions about resources or objectives? Okay, let's go to activities and outputs. So we've talked about what you're putting in, staff time, dollars, whatever, and you're creating some activities. You're creating trainings, or you're developing curriculum, or you're building relationships, or having meetings or webinars such as this. Those are all activities. If you're looking at a process evaluation, that would be very important to look at activities. As you think about outcome evaluations and other type of evaluations, the activities are important, but it's also what it leads to, which in this case are your outputs. How many people did we serve? How many people got trained? How many new partnerships were developed? It becomes very difficult, I think, in program evaluation to understand, especially outputs versus outcomes and impacts. And I wanted to kind of sit and focus on these for the last few minutes we had. So again, outputs are those things that you've done. You've served patients, you've created webinars, you've developed trainings and actually conducted them, you've formed new partnerships, whatever. You've done those things that you've done based on your activities, and that are going to lead to other things. Let's talk about what those other things are. So we've talked about outputs. We've trained people. What have we done? We've trained people. We've had more patients served. So did we, as an outcome, did we change behavior? Did we change knowledge? Did we change somebody's status or ideas? As you think about outputs, think about it, again, as I talked about, short, intermediate, and long term. And think about things like, if we did a training, what's a good example? So one of the programs I looked at when I was doing it was training more physicians in primary care. So your training, so your output would be the actual training, but your outcome would be more physicians who decided to go into primary care or practice in community rather than going into the hospital, practicing in vulnerable communities. So that's a change in behavior or status, but your output was the actual training. And then think about your impact. That's very much long-term. Did I change how people accessed health care? So maybe I have more people going to primary care, less people having avoidable hospitalizations, less people using the ER. As I think about this throughout the kind of a continuum output, what did I do? I trained people, I graduated people. Actually, my activities are I trained people, my output is I graduated people, my outcome is I now have more people in primary care. They've said, I want to do primary care, I want to work in the vulnerable communities. And now my impact are going to be long-term. I've changed how somebody accesses care. I've got less, again, less avoidable hospitalizations, less ED use for what we consider primary care. So again, as you think about this continuum, again, it's really difficult to break down output, outcomes, and impact. Does anybody have any questions about this? The last thing, and again, so one of the things I'm going to do is, in 2 weeks when we do this again, we're going to start kind of going over this these concepts again for the logic model, then we're going to actually apply it. We're going to take some of your programs and actually go through creating an evaluation, both in terms of a project evaluation and a program evaluation. Again, we want to think about this very broadly. How do we look at an individual project, as well as from your point of view as project officers, how do we look at a program and decide if that program is doing what that program intends? So finally, I want to talk about data a little and what data you need. So again, as I said a while ago, most logic models don't include a column or columns for indicators and sources, but I think it's important as you walk your way through the logic model to go from your project objective through your resources, activities, outputs, outcomes, and impact to how do I measure that? What data do I need to say that I was successful? So for example, if my output is more people working in primary care in a community, I may have to go to the AMA master file and count the number of physicians that are now doing primary care. So I've talked about not only how to measure it, but the data sources. And in some cases, you have to think about data sources as either a primary data source, something that I actually have to create because there's nothing available, or a secondary data source such as the master file, such as the American Community Survey. Again, other iPads that shows about graduations. Something that can give you data you may not have to, that you may not need to collect. We've got only about 4 minutes. There's the logic model. Does anybody have any questions? I know this is very, intense in terms of some of the terms. And again, I want, in 2 weeks when we go over this, I'm going to start with the terms again just to refresh us as we walk through. But does anybody have any questions? Amanda, do you have any thoughts as we go, as we kind of conclude this first webinar?
No, I thank everybody for joining us. If questions come up, please know you're welcome to ask them at the next webinar, and just remind you that we're going to get into a lot more detail on logic models, and so that was just kind of a quick introduction and set us up for what we'll be going over in the next webinar. But thanks everybody for joining today.
Yeah, I didn't include Amanda's, but I did include my email. So if you have questions, you can send it to me, and I will share them with Amanda, and one or both of us will get back to you. Not a problem. Thank you very much, and we will talk to you in a couple of weeks. Thanks, and have a good evening.
Thanks, everybody. Bye.